When we picture the ultimate healthy, low-impact exercise, I feel like we usually picture someone just gliding down a scenic road on a bicycle.
Oh, totally. It's praised as like the perfect cardio. Clean, efficient.
Right, and easy on the joints. You just get on the saddle and pedal.
Mhm.
You'd think a bike is just a bike.
Yeah, you really would.
But when you actually dive into the biomechanics research and the clinical data we have today from places like Manuel and Santino Schultz, you realize that sitting on that tiny hard triangle for hours is creating this massive hidden health crisis.
It is the absolute definition of a structural blind spot. I mean, we tend to assume the only real danger in cycling is traffic or, maybe a scraped knee.
Yeah, exactly.
But the reality is that the physical interface between the human body and a standard bicycle saddle
Yeah.
is just fundamentally flawed for a huge portion of the population.
Which brings us to the specific mission for our deep dive today. We're pulling together sources that span pelvic health clinics, biomechanical engineering, and sports medicine to answer a question that the cycling world rarely talks about at dinner parties.
No, they definitely avoid this one.
Right. The question is, can cycling affect vaginal sensation, especially after undergoing treatments for other pelvic conditions? Because the statistics in our sources are just staggering.
They really are.
Like, up to 90% of regular riders experience some form of pelvic discomfort. But for women, it can profoundly impact sexual health, function, and actual physical sensation.
Yeah, and to understand why a bicycle can literally kill physical sensation, we first have to look at the hidden anatomy being, well, crushed against the seat.
Okay, let's get into the anatomy.
The focal point of all this research is the pudendal nerve. So it branches off your lower spine, travels deep through your pelvis, and passes through this very narrow anatomical tunnel called Alcock's Canal.
And this nerve is essentially like the main communication cable for that entire region, right?
Oh, it handles almost everything. The pudendal nerve provides direct sensation to the clitoris, the vulva, the perineum, and the anus.
Wow, so everything.
Pretty much. It also controls the motor functions for your bowel and bladder, so when it functions normally, everything feels connected and responsive. But the inherent problem with cycling is that traditional saddles force your body weight onto the soft tissue of your perineum.
Wait, so you're saying we have sit bones built to handle our seated weight, but standard bikes force us to sit on the unprotected soft tissue instead?
Yes, exactly. The human skeleton is designed to bear seated weight on the ischial tuberosities. Those are your sit bones. But on a bicycle, you are often leaning forward to reach the handlebars, right?
Yeah, to be aerodynamic or whatever.
Right. And when you pivot forward, you entirely abandon those strong bones. You roll your pelvis and place all your upper body weight directly onto the perineal soft tissue.
Ouch.
Yeah, this physically crushes the pudendal nerve against the saddle, and at the same time, it chokes off the internal pudendal artery.
I was reading one of the lab studies in our sources, and my jaw actually dropped. Researchers put riders on stationary bikes and measured the transcutaneous oxygen pressure, basically just how much oxygen was actually making it to the genitals.
The results of that are wild.
They are. With a narrow, heavily padded saddle, oxygen dropped by over 82%. But even the absolute best saddle they tested decreased oxygen pressure to the genitals by 20% in just 20 minutes.
The speed at which that tissue is starved of blood is just alarming. You are essentially creating a localized tourniquet. And because Alcock's Canal is such a tight anatomical space surrounded by bone and muscle, there is absolutely zero room for the nerve to swell or, escape the pressure.
Okay, hold on though. We've all heard the jokes about guys getting numb down there, or the warnings about erectile dysfunction from bike seats. Aren't women's seats basically the same thing and just a little wider? Like, why is this being framed in these sources as a uniquely catastrophic issue for women?
Well, the assumption that female anatomy just needs a slightly wider version of a male seat is exactly what caused this crisis in the first place.
Really?
Yeah. Historically, the industry treated the female pelvis as just a scaled-down male pelvis. It was the classic shrink it and plink it marketing strategy.
Well, I hate that.
Right. But female anatomy requires fundamentally different structural support. Women typically have sit bone spacing that is 10 to 20 millimeters wider than similarly sized men. But more importantly, women have a much shorter perineal distance.
So the actual geometry of the pelvic floor is just completely different.
Drastically different. If a woman sits on a standard saddle designed around male biomechanics, Her sit bones completely miss the supportive rear part of the seat. They literally just hang off the edges.
Oh, wow. So there's no skeletal support at all?
Exactly. This means 100% of her body weight is instantly transferred to the center of the saddle, directly onto the soft tissue and that pudendal nerve.
That is awful.
It is. This is why our sources note that up to 50% of female cyclists report genital swelling or severe tissue changes just from saddle pressure.
That makes so much sense, though. If the equipment physically cannot support their skeletal structure, they are bearing their entire body weight on a nerve. So if the seat is wrong and the nerve is being crushed, what does that actually feel like for the rider? Because the sources indicate it goes way beyond just a temporary pins and needles feeling when you hop off the bike.
Yeah, it really does. Repeated compression and sheer force against this nerve leads to a chronic condition called pudendal neuralgia. In sports medicine, they sometimes nickname it cyclist's syndrome.
Cyclist syndrome, okay?
And the symptoms are a bizarre and highly distressing mix of sensory loss and hypersensitivity. So patients report a total loss of sexual sensation, severe difficulty achieving orgasm, or sometimes a feeling of vaginal looseness.
Yeah, I saw that in the clinic notes and I had to stop. How does a crushed nerve cause a feeling of muscle laxity or looseness?
You have to remember that the pudendal nerve doesn't just process feeling. It also controls the motor function of the pelvic floor muscles.
Oh, right, the movement part.
Right. So if the nerve is damaged by repetitive crushing, it loses its ability to send a clear signal to those muscles to contract properly. You basically lose that baseline muscle tone.
Got it.
The muscles literally weaken over time, which results in a feeling of laxity, making intimacy very difficult.
But then, on the flip side, the sources say damaged nerves can also misfire and cause severe pain, like people describe burning, stabbing pain, or the sensation of sitting on a golf ball.
That golf ball feeling is a really common complaint, actually.
Yeah, or severe pain during sex, which is called dyspareunia. And then there is PGA, persistent genital arousal disorder.
PGA it's a constant, incredibly uncomfortable feeling of physical arousal, but without any actual psychological sexual desire. It can be devastating for patients, and it's a direct result of nerve trauma.
I really struggled to understand this part of the research, to be honest. How can nerve damage cause total numbness, where you feel absolutely nothing, and unwanted arousal or stabbing pain at the exact same time? That sounds completely contradictory.
It does seem totally paradoxical until you look at how nerve fibers are actually constructed. Think of the pudendal nerve like a complex electrical wire. Surrounding the core of that wire is a protective coating called the myelin sheath.
Okay, the myelin sheath.
Yeah, and when you repetitively crush and shear that nerve against a bike saddle, you physically fray and damage that myelin sheath.
Like stripping the rubber insulation off a copper wire.
Precisely. And once that insulation is degraded, the nerve's signaling system just breaks down into chaos. Sometimes the electrical signal just shorts out completely and fails to reach the brain at all.
And that's the numbness.
Exactly. That manifests as numbness and a total loss of sensation. But in other nerve fibers right next to it, that exposed frayed wire starts sparking wildly. It sends these chaotic panic signals up the spinal cord.
Oh, I see.
The brain receives those panic signals and just misinterprets them as either searing pain or, in the case of PGA, intense physical arousal.
So the brain is basically just receiving scrambled static from the pelvis and literally doesn't know what to do with it. That is terrifying. Which brings us to the core of this deep dive. If the myelin sheath is that fragile, what happens if that ecosystem is already compromised before you even get on the bike?
Well, this is where the risk of developing pudendal neuralgia absolutely skyrockets. If your pelvic floor is already vulnerable from a major life event or a medical procedure, putting it on a bike saddle creates the perfect storm for severe nerve damage.
Let's look at childbirth first. The clinical sources say nerve damage occurs in 32% of all vaginal deliveries. Just the act of delivery stretches the pudendal nerve significantly. But what happens when there is tearing or an episiotomy?
The major issue there is the healing process. When the body repairs a tear or an episiotomy, it lays down dense, inflexible scar tissue. And often, the pudendal nerve gets caught up in that web of scar tissue. It becomes physically entrapped.
So it's stuck.
Exactly. Normally, when you pedal a bike, your hips sway, and the nerve glides smoothly back and forth through Alcock's canal. But if the nerve is glued down by scar tissue, it can't glide. Instead, it gets yanked and violently compressed against that rigid scar tissue with every single pedal stroke.
I also saw a lot in the sources about menopause compounding this issue, but I wasn't entirely clear on the link there. Does a drop in estrogen actually change the structural padding down there?
Oh, it changes the entire cellular makeup of the tissue. The British Menopause Society details a condition called GSM, genitourinary syndrome of menopause.
Right, GSM.
Post-menopause, the severe drop in estrogen causes fibroblasts, those are the cells responsible for producing collagen, to essentially go dormant.
They just stop working.
Pretty much.
Mm.
The existing collagen matrix in the vaginal and perineal tissue dries up and the fibers fuse together. You lose all elasticity, the tissue physically thins out, and the protective mucosal layer just diminishes.
Okay, but a lot of the clinic blogs mention treatments for this. Like if someone is being proactive and using vaginal estrogen therapy or maybe undergoing pelvic laser treatments to stimulate that collagen and rebuild the blood flow, doesn't that fix the problem?
It definitely helps the tissue regenerate, but you really have to consider the state of that regenerating tissue. When you use laser therapy or localized estrogen, you are waking up those fibroblasts to build new, delicate collagen fibers.
Okay.
That tissue is in a highly active state of recovery. It is incredibly vulnerable to mechanical friction and shear forces, and a standard bike saddle introduces massive amounts of friction. So you are essentially taking fragile, newly regenerating tissue and subjecting it to repetitive microtrauma.
It makes me think of driving on a patched tire.
Oh, that's a good way to put it.
Right. Like the bicycle didn't cause the initial puncture. The childbirth or the estrogen drop or the tissue thinning did. But the repetitive stress of pedaling, like the friction and the concentrated weight, is exactly what causes that patch to fail.
That is a highly accurate analogy. The mechanical stress exploits the existing vulnerability. And we see the exact same compounding effect with pelvic surgeries.
Like what kind of surgeries?
Procedures like pelvic organ prolapse repair, hysterectomies, or surgical mesh placements, they all leave deep postoperative scar tissue. But beyond just the scar tissue, surgeries introduce a secondary threat, which is hypertonicity.
Hypertonicity. That's when the muscles themselves are locked in a state of tension, right? Like a constant muscle spasm.
Yes. If you have undergone a painful pelvic condition or treatment, your pelvic floor muscles often develop a guarding response. They exist in this state of high tension, constantly bracing against anticipated pain.
Wow, just waiting for it to hurt.
Exactly. The pelvic floor is shaped like a muscular bowl or dome. When those dome-shaped muscles become rigid and locked up, they physically swell and narrow the space inside Alcock's canal. So the nerve is already being squeezed tightly by your own muscles from the inside.
And then you sit on a poorly fitted bike seat and you compress it from the outside too. You're crushing it between a rock and a hard place.
Exactly. It is a guaranteed recipe for neural trauma.
So if someone listening right now loves cycling but relates that numbness we talked about, or they're recovering from pelvic floor therapy, what is their actual move here? Do they just have to quit the sport?
No, you absolutely do not have to hang up your helmet forever, but you have to radically change the mechanical interface between your body and the bike. You cannot just ignore the warning signs.
Instinctually, if my seat is causing nerve pain, I would think the solution is to just go online and buy the biggest, thickest, most plush gel seat I can find. Just put a giant squishy pillow under the pelvis.
That is actually one of the fastest ways to make the problem significantly worse.
Wait, really? How does extra padding make nerve compression worse? I feel like everyone does that.
They do. But consider what happens biomechanically when you sit on a highly padded, squishy surface. Your sit bones, the hard skeletal protrusions that are supposed to bear your weight, they sink straight down into the deep foam.
Okay.
And when the bones sink down, all that foam and gel has to go somewhere. It displaces, it pushes directly upward, filling the space between your sit bones, pressing right into the soft tissue of the perineum.
Oh, wow. It's like stepping into deep mud. The heavy part sinks, and the mud just pushes up directly into the arch of your foot.
That's the exact mechanism. The pressure goes right back into the center, completely defeating the purpose and crushing the pudendal nerve even more. So instead of soft and squishy, you actually want a saddle that is firm, supportive, and highly adjustable.
The engineering deep dives in our sources spend a lot of time on adjustable geometry. It seems saddle manufacturers are finally realizing that static, fixed-shape saddles fail women, because female anatomy is just incredibly diverse.
Right. You cannot have a static, one-size-fits-all solution for a highly dynamic, individualized problem. This is where companies designing adjustable saddles, like Basaddle, have completely changed the paradigm. They engineered saddles that consist of two independent halves that slide along a custom rail system.
So you aren't just adjusting the height of the seat, you can physically alter the width and shape of the saddle itself.
Yes. You can independently shift the rear width anywhere from 100 millimeters to 175 millimeters.
That's a huge
It
range.
is. This means a single saddle can be dialed in perfectly to match your exact sit bone measurement, whether you have a very narrow pelvis or a very wide one. And because the two halves are separated, it creates a physical bridge. Your sit bones anchor your weight on the firm pads, and the center is completely hollow, offloading the pudendal nerve entirely.
But the sources also make it clear that the seat is only part of the equation, right? The overall bike fit plays a massive role, specifically the handlebars. If you are leaning really far forward to reach low handlebars to be more aerodynamic,
Yeah.
what does that do to the pelvis?
When you reach low, you force your body into a severe anterior pelvic tilt. You are rolling your pelvis forward, which rotates your sit bones backward and exposes the most sensitive anterior part of the perineum directly to the nose of the saddle.
So you're basically putting the nerve right in the line of fire.
Exactly. But simply raising your handlebars allows you to sit in a more upright posture, which naturally shifts your body weight back onto the skeletal structure where it actually belongs.
Let's say you've made these mechanical adjustments. You've got the adjustable saddle, you raise the handlebars, and you go for a ride. At minute 45, you start to feel that familiar tingle, that numbness creeping in. Should you just stand up on the pedals for a minute, shake it out, and then push through it to build a tolerance, like building a callus on your hands when you lift weights?
I want to be incredibly clear on this point based on all the clinical literature. Never push through nerve pain, ever.
Okay, wow. Good to know.
Yeah, standing up on the pedals every 10 to 15 minutes is a fantastic preventative measure to restore blood flow during a normal ride. But if you stand up and the numbness persists, or if it turns into a burning sensation, the nerve is actively being damaged. You cannot build a tolerance to nerve compression.
Because it's not a muscle tearing and rebuilding, you're just doing more permanent damage to that myelin sheath we talked about.
Exactly. If symptoms persist after adjusting your bike, you must stop the aggravating activity and let the neural tissue heal. And this is where the clinical sources highly recommend seeking out pelvic floor physical therapy.
How does physical therapy help a crushed nerve, though? Do they massage it?
Well, a specialized pelvic floor physical therapist doesn't just massage the area, they address the structural environment around the nerve. So if you have that hypertonicity we discussed, the locked up muscles guarding against pain, a PT uses manual therapy to release that tension, widening Alcock's canal back to its normal diameter.
The clinic blogs also mention nerve gliding. What exactly is that?
Nerve gliding involves specific, targeted movements designed to gently pull and stretch the nerve through its pathway.
Like flossing it.
Yeah, exactly like flossing. It essentially trains the pudendal nerve to slide freely through the canal without getting snagged on any existing scar tissue from childbirth or surgeries. They also use biofeedback, which helps you visually see your muscle contractions on a monitor, so you can literally relearn how to relax your pelvic floor and stop unconsciously squeezing the nerve.
It's amazing how much of this comes down to just understanding the machinery of our own bodies.
Yeah.
I feel like so many riders probably think this discomfort is just part of the sport, something everyone deals with.
Knowledge really is the most valuable intervention here. When you understand the biomechanics, you realize that pelvic pain and loss of sensation aren't personal failings or inevitable consequences of aging. They are mechanical problems with mechanical solutions.
Let's recap the core insights we've uncovered from this stack of research. We've seen exactly how the repetitive compression and sheer forces of a standard bicycle saddle can absolutely devastate the pudendal nerve. This localized trauma can lead to a profound loss of vaginal sensation, chronic pain, or even unwanted physical arousal.
Right.
And this risk is amplified exponentially if your pelvic floor is already vulnerable from childbirth scar tissue, the structural thinning of menopause, or the hypertonicity that follows pelvic surgeries.
Yeah, and the big takeaway is that the solution isn't adding more squishy padding, which just displaces pressure back into the nerve. The solution is utilizing firm, adjustable geometry that forces your skeleton to do the heavy lifting, paired with professional bike fitting and pelvic floor therapy to resolve any underlying muscle tension.
Which brings me to a final thought I want to leave you with today.
Yeah.
We talked about how, for over a century, the standard bicycle saddle was designed almost exclusively around male anatomy.
Yeah.
The industry simply ignored female biomechanics, leaving millions of women to quietly suffer from severe nerve damage because they assumed the pain was just the price of admission for a good cardio workout. It really makes you wonder how many other everyday objects, tools, or pieces of equipment are secretly working against your physical health right now, simply because they were never designed with your specific anatomy in mind. Next time you feel that numbness or pain, remember, the machine is supposed to fit you. You shouldn't have to break yourself to fit the machine.